Good evening and welcome to masters, fellows, awardees, visiting dignitaries, members of the Board of Regents and Governors, staff, family, and friends. I want to particularly recognize my wife Diane, who has traveled with me this year, my daughters Paige and Faith, and Paige's boyfriend Chris, all of whom are here today and have been with me through the triumphs and travails of practicing medicine. So it is with great honor and privilege that I stand before you. Tonight, I would like to talk about courage and sacrifice, gratitude and authority. The courage and sacrifice of my parents to immigrate from the other side of the world nearly 60 years ago to seek opportunity for themselves and their children. My father was a biochemist and a co-discoverer of the glycoprotein molecule, but struggled for years to receive a tenured faculty position. My mother had a graduate degree in economics, but had to work as a key punch operator for years. They both endured professional and social discrimination based on the color of their skin, the accent of their English, and the pattern of their dress. There were many moments when they considered returning to their native land of India, but they didn't. They knew that this was a country of ideas, great opportunity, and promise. They sacrificed and were determined to make a life for themselves and for their children in America. So I stand humbly before you today in their shadows. But mine is not a unique story, but one repeated millions of times around the world and perhaps in your lives. Perhaps you too have gained from the sacrifice and courage of your parents or your family or friends or colleagues. You too have had to make choices in your careers and personal lives. So we have all gathered today to celebrate that sacrifice and take pride in your accomplishment and the knowledge, skill, and empathy you bring to your patients and the professional and ethical standards of the American College of Physicians that you abide by every day of your career. As I traveled the world representing ACP from the island of Taiwan, Panama City, Panama, to the villages of Indonesia, to the modern cities of Doha and Abu Dhabi, and the cobblestone and canals of Old World Amsterdam, I was inspired by the people that I met. I was also humbled by the talent and dedication internists around the world. Some are practicing in rural and resource-poor areas, fighting Ebola, HIV, malaria, dengue, and waterborne diseases. Others are providing state-of-the-art specialty care. Others are advancing knowledge through basic science research, teaching, or conducting clinical trials. And some are caring for patients in urban or suburban settings like me. But the common thread is the commitment to advance humanity, better lives, and seek a world where all lives have equal value. As I traveled, I also saw the respect with which American medicine and the college is held. Internists around the world seek knowledge through workshops and lectures, products such as MKSAP and Annals of Internal Medicine. They look to ACP to set standards for ethics and professionalism in the practice of medicine. Some seek the same opportunities that my parents sought to create lives and careers in America, and others to seek affirmation for their accomplishments with the honor of advancement to fellowship and mastership like you. As I traveled in America to Illinois, California, Wisconsin, New Jersey, Massachusetts, Georgia, and Michigan, I experienced the diversity of our country and witnessed disparities in healthcare delivery, the demands on internists to stay in private practice and sustain work-life balance. But there was also a great sense of joy or reward in caring for patients, being stewards of their health, and gaining knowledge over the arc of their careers. So as we gather today, our patients and profession face many challenges. Our patients seek access to high-quality, affordable, coordinated health care as a fundamental human right, like public education. They seek affordable prices for medications, medical and surgical services, and they seek health insurance that is affordable for all Americans. They trust us to be current in our knowledge and offer our experience, judgment, and wisdom. Patients look to us to help solve the problems of prescription drug costs, opioid dependence, the #1 cause of accidental death in this country, provide access to compassionate and ethical end-of-life care, protect against gun violence, address the social determinants of health, provide adequate mental health care. They look to us to advocate for women's health rights and mitigate against the greatest health threat of the 21st century, global climate change. Finally, patients and clinicians expect us to stand firm on our moral and ethical conviction of non-discrimination of any kind based on race, ethnicity, religion, gender identity, or sexual orientation. But our profession is at a tipping point. We are internists who have the knowledge and skills to care for complex and chronically ill patients. We are master diagnosticians in addition to practicing disease prevention and population health. But we are struggling for identity within the House of Medicine and society. General internal medicine is in crisis, with very few choosing this as a career. We are at risk for only becoming a foundation for further training in subspecialty medicine. We need to once again distinguish ourselves to society on our unique and critical role. Medicine has changed, and we need to change with it. We are the subjects of disruptive technology with the electronic health record. We are burdened with coding requirements for billing purposes and prior authorizations for tests, medications, and medical equipment. In addition, we are now tasked with managing the cost of care and taking risk in a for-profit medical industrial complex where attempts to control those profits will be met with great countervailing forces. Initiatives such as merit-based incentive program, accountable care organizations, or comprehensive primary care plus hold promise to increase the quality of care for some chronic conditions and improve prevention strategies with decreased costs. But it remains unclear if this will be significant and sustainable over time. We know that the vast majority of healthcare costs are attributable to hospital care, surgeries, procedures, and pharmaceuticals, advancing technology, the aging population, and unhealthy lifestyles that lead to the burden of chronic diseases. The needed fundamental change is the reevaluation of non-cognitive and cognitive services to more accurately reflect the knowledge, skill, time, and value they bring to patient care. As practicing internist, it is paradoxical to me that one of the lowest paid specialties in medicine, and one that accounts for only 2% of healthcare costs, is asked to control the costs of the medical industrial complex and monitor referrals, testing, emergency room visits, and hospitalizations for a marginal increase in payment for after expenses to internists and subspecialists. We take pride in our thirst for knowledge and for learning new skill sets. We believe in standards for certification and maintenance of certification. But we need to transform the acquisition and assessment of knowledge to one that is less burdensome, less costly, interactive, and improves the quality of care. ACP continues to work towards these transformative changes to support new model of lifelong learning. The issue of resilience and wellness, or quote-unquote burnout, looms large, especially amongst our trainees and early career physicians. Surveys indicate that 60% of internists have some symptoms of dissatisfaction, anxiety, or depression. Several factors are contributing to burnout, including complex reporting requirements, administrative burdens, poorly designed electronic health records, and a lack of autonomy on the type and schedule of our work. The college, in collaboration with other organizations, has recognized this and is active in finding solutions to a problem with serious consequences. But one antidote to burnout that I have discovered as I travel the world is gratitude. As Marcus Cicero said, gratitude is not only the greatest of virtues, but also the mother of all others. We should have gratitude for the education we have received, the opportunity to serve humankind, lifelong learning, and the privilege to experience our patients' lives, sharing their most intimate thoughts, celebrating their successes, empathy and comfort for their sorrows, and having the trust of society. You are members of an elite group to whom much has been offered, and you should take pride in the service that you give back. Create balance in your lives with volunteerism, time with family and friends, physical fitness, varied interests, and mindfulness. So today we continue the tradition that first took place in Pittsburgh, Pennsylvania in December of 1917. There, 78 new fellows came by train, horse, and Model T from all across the country to become fellows and masters of the college. They took an oral and written exam, with one member actually failing for not carrying digitalis leaf in his bag. Today, you sit in the seats occupied by fellows, including Hugh Butte, who developed a method to treat hemorrhagic jaundice with vitamin K in 1938. William Kolff, who invented dialysis in 1943. Burgine Overholt, who developed the flexible sigmoidoscope in 1961. Lee Goldman, who developed the first cardiac risk index in 1977. And Harvey Alter, who identified non-A, non-B, or hepatitis C virus in 1988. The pledge they took, and the one you will take shortly, dates back to the Hippocratic Oath and the Golden Rule, but still applies today as it did thousands of years ago. The first formal college pledge was in 1924, and it was revisited in 1982. It is a pledge of professional calling, to act always in the best interest of patients, respect the integrity of colleagues, provide professional aid to the unfortunate, and increase medical knowledge through study and practice. Fellowship and mastership are honors bestowed for scholarship, professional accomplishments, and personal integrity. They are designations that carry honor and pride. They are designations from which you will gain no financial benefit, but are milestones in your career, provide personal fulfillment and the respect of your colleagues, teachers, patients, and profession. In addition, as fellows and masters, you have an opportunity to affirm your commitment to the Physician Charter. Its principles include the primacy of patient welfare, autonomy, and social justice. Its responsibilities include a commitment to professional competence, honesty, and confidentiality. It is also a commitment to improving quality and access to care, careful use of resources, and advancing medical knowledge. It remains relevant to our time and is not to be taken lightly. The Charter is fundamental to the practice of medicine and our contract with society. This trust that society has bestowed upon us is one we cannot jeopardize. But things must change for the reasons stated earlier, and you have the authority, respect, and trust of Americans to make those changes. You must become leaders in setting policy that keeps the patient at the center of care and recognizes the importance of general internal medicine, the hospitalist, the subspecialist, as leaders of the healthcare team that provide high-value care. This is a pivotal moment in American medicine. There are unique opportunities before us. We need you to become leaders in setting the standards for uniform and meaningful quality measures. Leaders in an evolving payment system that values cognitive services, is value-based, and perhaps leads to payment for a demographically and complexity-adjusted global patient panel. We need you to be leaders in forcing governmental agencies and Congress to make vendors develop more functional EMR systems that are truly interoperable. We need you to take back the profession and move from dystopia and closer to utopia. And the American College of Physicians is and will be there to help with this transformation. So imagine a world of healthy lifestyles, the use of 100% renewable energy and a healthy planet, minimal chronic disease, gene-based therapies, stem cell research, robotics, artificial intelligence, and algorithms, universal access to high-quality and affordable care, information technology that is seamless and interoperable, time with patients, the excitement of making the correct diagnosis and instituting a treatment plan, and adequate payment and work-life balance. That world is a possibility, and you are charged with creating such a world. In the words of John F. Kennedy, our task is not to fix the blame for the past, but to fix the course for the future. Your voice should be heard in the boardrooms of companies and healthcare systems, academic institutions, practices and community centers, town halls and civic groups, the halls of Congress, and even the White House. Perhaps you could run for federal, state, or local office, participate in setting public health policy at the state and national level with positions in government agencies. It will take courage, and there will be disappointment, but we all must persevere for our profession and our patients. So I challenge you today to go home and make one new commitment to your profession and to your personal lives that will improve the health of our patients, your profession, and your life. Look around as the people who will support you are at home or in this hall. They have been there and have sacrificed as you have, because they all recognize the greater calling that is medicine, as symbolized by the caduceus that I carry today. My improbable journey could be yours. The thought of standing here before you today was unimaginable. But you have the same opportunities to lead change through your values and vision for the future of healthcare. Perhaps become a leader like the people behind me. Use your authority to take risk, be courageous, have gratitude, and as Mahatma Gandhi said, be the change you wish to see. Congratulations to all the new fellows, masters, and awardees.